This is Youth at Crossroads.
Youth at Crossroads.
A program that brings out expressions of young people.
I would like to pick your minds on this question. Who is your ideal date?
Youth at Crossroads.
A person can think about dating when they are mature enough to handle it.
Youth at Crossroads.
I'm of the person that age is nothing but a number. When you're good enough, you're good enough.
Youth at Crossroads.
Hello and welcome to today's edition of Youth at Crossroads. To present, my name is Boniface Chansam Copper, and for today we will focus our attention to the state of sexual and reproductive health rights in Zambia. I am sure you will agree with me, won't you? It is an interesting topic, and the need for information on sexual and reproductive health rights, as well as access to sexual and reproductive health services, cannot be overemphasized. In 1994, sexual health was incorporated in the definition of reproductive health contained in a report on International Conference on Population and Development (ICPD), following which the understanding of sexual and reproductive health rights has reached an advanced level. And so in the studio to help me discuss sexual and reproductive health rights in Zambia, individuals with expertise, experiences, as well as understanding on sexual health as well as reproductive health. One is from SACOD, that is Mr. Armitage Mombwadi, who is the Human Rights Defenders Network coordinator, as well as law students from the University of Zambia. That includes Emmanuel Mwangaila, as well as Messi Mwamba. And lastly, but not the least, we do have somebody from Youth Action Movement, that is Kondwelani Kamanga. Welcome to the program.
Thank you so much.
And as I mentioned, we are focusing on sexual and reproductive health rights. Would like to understand the state of sexual and reproductive health rights in Zambia. First things first, maybe you may help us understand what sexual and reproductive health rights are. We start with Messimon. What's your take?
Thank you very much for the great question. So sexual and reproductive health rights are human rights that are related to sexuality and reproduction and health, because obviously we know that human rights are basic entitlements that every human being has by virtue of being human. So they're related to this definition in the sense that they fall under the rights, so they are just sexuality and reproduction rights.
And maybe do you have something to add insofar as maybe the components of sexual and reproductive health rights? I mean, you may come in, somebody from Youth Action Movement, Kondwelan.
Okay, thank you. So it has different components that's under sexual reproductive health rights. One of the components is to prevent and treat HIV and STIs. We believe that young people mostly get sick of HIV and also STIs. So one of the components is to prevent and treat STIs. The other component is to access menstrual health hygiene among young women or adolescents, so that they have sanitary pads to help them once they're on their periods. The other one is access to contraceptives and so family planning. We believe that young people get to involved in unplanned sex, so if they can access contraceptives, we can prevent unintended pregnancy from them. Thank you.
All right. Quite insightful. That maybe we also understand the differences between sexual health as well as reproductive health, as indicated in the topic itself. There's also the difference between sexual rights and reproductive rights. Maybe to break down those, I invite you, Emmanuel.
So I think sexual health mostly focuses on the well-being related to someone's sexuality and their sexual behavior, and that includes the the prevention of maybe sexually transmitted infections and ensuring a positive and respectful approach to their sexuality. While reproductive health, on the other hand, deals with the aspects of reproductive processes, including pregnancy, their childbirth, and reproductive system health. Sexual rights involve the right to a fulfilling and a safe sexual life, while the reproductive rights emphasize the ability to make the decisions about reproduction without anyone's interference.
Oh, great. Is there anything different you wish to add, Mr. Mumbwati, on the same? Yes.
Yeah, basically,
as you're about to venture into the benefits of sexual and reproductive health rights, as well as investment in the services that concern sexual health as well as reproductive health.
Yeah, maybe just to add on, when you talk about the rights, generally, basically, you're talking about all human rights. But now, when we focus on the health rights and maybe talking about sexuality, we are looking at, you can't talk about rights without mentioning the government. So we are talking about what people are able to access, the freedoms that they have, the right they have, the access to medical health services, issues like abortion, right to decide to abort or not, right to decide who to be your partner, or right to decide who to have sex with, or who to have a child with, or whether to have a child or not, or when to have a child or when not to have. So you talk about those things that they're included in issues of sexual rights. So we're talking about the freedoms and the liberty, and you are free to decide which doctor to attend to you. We're talking about also privacy. We're talking about the aid in cases of people with a disability, the aid that you can receive for you to access.
Yeah, I'm glad you've mentioned some of the categories which could have been disadvantaged one way or the other not to have access to these services. You talk of the minority groups, persons with disabilities included, and maybe you may highlight more on that. How significant, how important is it to have knowledge on sexual and reproductive health rights?
Okay, I'll use the biblical text which says, how can they believe if they have not heard? So how can they act if they have not been told, if they don't have the information, if they do not know? So it's very important for everyone, inclusive people with disability, young people, women, to have access to information about their rights, about their right to health. This is going to make them, without you telling them, to walk on their own and go and demand and access that facility and also the products without you taking action, because you would have made them know. So when the information is available to them, it is the information that makes them to act and act right. It is the information that will make them demand and demand the right thing. It is the information that will make sure that the facility that they want will be actually provided. We're talking about right to, to access universal health care.
Yes.
These are some of the international recommendations and instruments that are instructing us. But if people do not know, how can they demand for this? So it's very important for them to have information. They also make individual personal decisions about their life, about their body, what they want on their body and what they don't want. So these rights information are very, very important, because the world is changing. In our country, there are things that we can't promote and there are things that we can promote. So if people do not know, they will end up promoting wrong things.
Yeah, you're coming from Human Rights Defenders Network, and you being the coordinator, maybe from your analysis of the situation, the current of affairs in Zambia, how enabling is the environment in Zambia for sexual and reproductive health in relation to maybe policies, laws, regulations, as well as maybe factors that may relate to economy, as well as social structures, cultural factors as well?
That's a very, very broad question
Yeah,
you're asking.
loaded.
Yeah, very loaded. But then suffice to mention the fact that Zambia has a very enabling environment as far as sexual rights are concerned, because people decide who to marry. It's different from other countries where maybe someone is chosen for you. So in terms of choosing your partner, you have that. The environment is very enabling. The policies are very enabling. Maybe we just have a few things that we need to pan a bit. Things like consent. You know, there's an age of consent for a child or a youth to access healthcare or services. For example, this is a young person who's been sexually active and they want to access the health services. And maybe the first thing the person is going to ask them, or will be surprised and shocked when they look at them, oh, even you want to access contraceptive, products. They are shocked, and then that is an issue that is going to make a child shy away or stay away because they think that people are laughing at them.
So what is the current age for somebody to have consent?
If you're below it is 13, I'm not very accurate about the age. You need guidance and consent from your parents. But now imagine that you are sexually active already, because some people get sexually active at 10. Then they want now to access the contraceptive, and then the personnel there will be shocked and ask them, oh, even other people like the disabled people, when they go there, the challenge is that when you want to access the service provider will be shocked at you, and they'll actually say, oh, have you been raped? Have you been defiled? Who had sex with you? Even when they also have the right to consent, maybe they should be, promoted and encouraged that, oh, this is very good that you're also able to access the facility. But when I meet that person as a health personnel, I'll be shocked to say even the blind person, even the person who, who is lame is able to enjoy or to have sex. Then people wonder how could they also have sex, even when they also have sexual feelings.
Definitely.
So the atmosphere, the attitude, the consent requirement somehow bars them from accessing these services. Also, when you talk about the law on abortion, we have a Termination of a Pregnancy Act. It's a bit limiting because it is requiring that the PS should sign. There should be a 3 months notice. There should be a process, and when they don't consent, they don't allow, it means that you won't access that service. So that's a bit of retrogressive in our Zambian setup, because the world is at a high speed now. Young people want services, they want to abort, they want to be clean, they want to be, but if you give them those, stages, you are encouraging them actually to go against the law and do it quicker and faster. So there are other laws that are preventive of sexual freedoms. Like in Zambia, we all know that it's not allowed for people of the same sex to have sex. So that is not allowed or to marry in Zambia. But at the same time, you realize that this law wants a lot of evidence that you should have really known that these people were having canon knowledge against the order of nature. But at what point would you have that time to go and investigate and realize that these people really were having canon knowledge against the order of nature? So those are some of the issues that we need really to reattend to as a country and clarify. Again, maybe the other policy that is a challenge is, the government now have said we are going to have youth-friendly corners in schools where young people should be able to access, healthcare services on sexual related. But when the young people go there, this person is going to be the one to say, how many times do you want to be coming here? Last week you were here. Then again you are coming, So in the Zambian context, that is, you are retaining them not to come. You are telling them never come more than this number of times, because that is too much of you. So when a young person is told like that, they will start shying away and they will avoid that place. So maybe the government needs to ensure that the political will at the higher office has the same momentum to the last person who delivers the service. Because, for example, the minister says we want you to provide this service, but the human resource that you have employed at a school they have an attitude which you're not able to monitor. Maybe they even, discourage the young people to access, or maybe the facilities, the products are not there. So how best can we improve that situation? Because I think these are some of the things that we really need to attend to and address them locally. So you asked about cultural issues. Yeah, there's one thing that people do not appreciate. In as much as people have rights, also traditional leaders, or maybe as countries, we have also rights to culture. So we have the right to culture. We need to promote our culture. What does our culture say? What does it talk about on sexuality? What is it teaching? So we have the right to teach our children or the generation what we believe in as a country, as our cultural beliefs, as our traditional beliefs. We teach them as long as they are not repugnant with the international human rights. We have that right to teach them. But there's a way that people are approaching human rights as if it's against everything that the culture is supposed to promote. So maybe we need that integration and discussion further and do more about how best can we complement, and how can we get the best out of our situation.
All right, let me now move to how critical or effective comprehensive sexuality education in Zambia has been insofar as sexual health as well as reproductive health rights. Your comment, Messi.
All right, thank you very much for the question. I feel it has somehow helped, because this time around, unlike in the olden days, you find young people as early as grade 4, they're learning about reproduction and how to keep themselves healthy, and they'll learn about planned and unplanned pregnancies. They'll learn about all different things. And also they are, like, we used to call them sick bay, like in high school, I remember. We used to have this office where we used to have guidance teachers, and they used to be, they would teach about sex, and they would teach you about, like, how you can access condoms and everything. Like, I feel like they've made it more easier, and it's not like the way it used to be in the olden times, where parents would shun away from talking about sex with their children. I feel that has helped a lot, because when parents are shunning away from talking about sex with their kids and about these issues, they will tend to learn it from wrong people, and they'll follow whatever they learn, because children just follow everything they learn. So that I feel that has really helped. And also with the introduction of dreams, there's a certain movement, dreams, I don't know if you've heard about it. It also focuses on the same sexual health teachings and everything. And also with the introduction of the Gender-Based Violence Act, that was commenced in 2012, if not mistaken. I feel like that has also helped in the promotion of these sexual and healthy rights, as well as the Gender Equity and Equality Act that marries together with the Convention on the Elimination of All Forms of Discrimination Against Women in Africa and Everywhere. That act talks about how both men and women have the right to sexual health, as well as have the right to child spacing, child planning, and everything. So with the introduction of all these laws that I've mentioned, it is helping in the sense that women now know that they also have rights to choose when they can have kids and when they can, the child spacing, because when you don't know about something, you can't even claim it. So with the introduction of the laws and with the provisions that are there, I feel it has really helped. Also, like I said precurrently, on the introduction of medical law in tertiary levels, as well as gender law. They mostly talk about these sexual rights and everything, because like I said, back then it was so much of a big taboo talking about these issues, and you even be scared to just say sex. You feel like you've so much insulted.
Like you've insulted.
Like it was like that. But I feel like this time around, it has become more easy for people to learn, because you can only learn if you ask and inquire about it. But if you are preventing someone to talk about something, how are they going to learn? So in the end, they'll end up practicing, and while practicing, you end up being pregnant and everything, hence contracting these sexually transmitted diseases and everything.
So. All right. Speaking of Yeah, you've elaborated quite
to
a
add
lot.
on?
Yes.
Okay,
Maybe, yes, you may as well tackle the issue of prevention and treatment of HIV/AIDS, as well as maybe sexually transmitted infections, as you comment.
okay, so I want just to comment on this and to add on. So
Yes.
now the comprehensive sex education has been changed to LSHE, life skills and health education, because of
Oh.
the word sex.
Yes.
So the name has been changed. So it's now life skills and health education.
Okay.
Because I'm on the ground implementing it in schools. We have sessions with learners in schools to deliver different topics to them: HIV, STIs, teenage pregnancy, and obviously reduction of teenage pregnancy in schools, and also reduction of HIV in schools. Then to my question, prevention and treatment of HIV through CSC, sex education, we've seen a reduction of HIV transmission in schools. Normally, before this was put in schools in the curriculum, we used to have a lot of high teenage pregnancy and also high HIV transmission among learners in schools. And also we used to have school dropout. But there's a policy called Reentry policy which allows learners to come back to school after they fall pregnant while in school, both male and female. So that has helped also to reduce the infection of HIV from learners to learners. I think that's my take.
All right. Maybe as he has explained well on that one, maybe you can also take up the aspect of effectiveness of psychosocial counseling insofar as promotion of sexual and reproductive health rights. Emmanuel.
So, psychosocial counseling, I feel that it's being implemented quite well because
insofar as sexual concerns of people.
Yes, because I'm a peer educator,
Yes.
so I did the training with UNESCO. Yes, and the psychosocial counseling at Onza so far has been quite well because most people are now a bit confident to come and talk about these serious matters that they are facing, and they don't shy away. So the more we get to talk about it, and the more we like advocate for it, I think that's when people will be free. But when we shy away from it, even just mentioning the word sex is a taboo. I think people won't really be free to talk about it. But like this, the way people will listen to it at a wider audience, then people will be free about it.
Maybe just briefly, what other interventions would you recommend in promotion of SRHR, Mr. Mumbot?
Well, I think that as I always say, that the efforts that we are putting, I think they are very, very positive efforts. It's only worrying that PEPFAR is trying to withdraw the support for contraceptive, for the condoms. But I think that maybe recommendations would be that as a country, can we figure out how best we can continue providing and meeting the demand for condoms in our country. Probably working with the corporate partners, the social corporate responsibility from big companies. Maybe they can come on board and specifically fund a budget under the Ministry of Health that is going to ensure that we have these contraceptives that have been very, very important. And also maybe we should continue to make people aware about what the Ministry of Health is promoting, especially things like PEP and PrEP and all those, so that people are aware, because sometimes we take things for granted that people know and yet they really don't know. And the HIV and AIDS message is supposed to be consistent. It's supposed to be consistent or actually getting better, because every day there's a person who has a first encounter with the virus. Every day we have a person who is born who doesn't know about HIV. When you're born in this environment, you don't know the do's and the don'ts. So we shouldn't take it for granted that we've been talking about HIV now, it's we can forget. No. The same way people are talking about Jesus. There are people who are born today who need to know about Jesus. They don't know about Jesus. So even the newborn, they do not know about the prevailing situation in as far as their health, social health is concerned. Some people do not know about the pandemic. So we need not to relent. We need to keep on talking and ensure that in schools, yes, we keep on promoting and teaching. And also, I think that taking the new syllabus as it is, may really sound very, very insultive to some communities. Maybe we need to seek a way to meet the traditional leaders and also the traditional counselors to be able to understand why our children are supposed to discuss these issues at an early age, so that as they grow up, they are growing up with this information, because the world is changing. You know, when I was doing one of the community works, one of the fun questions that I was supposed to ask people was, how did you learn about sex?
Through their friends.
You know, you will realize that most of the answers, people didn't learn about sex from school. They know about sex from somewhere else. Or they just discover it, you know. Someone actually said, me, the first time I knew about sex, I saw domestic animals. I saw dogs at home. Then the other one says, no, my friend at school talked about it. The other one says, no, the senior most friend that we had talked about it. So you realize that none of them mentions the parents. So if parents continue to appreciate the fact that the world is changing and you need to talk about these things, I think that we're going to create a very big impact.
All right, great. Thanks. Maybe in the interest of time, your concluding message, Mercy, to the public and especially the youth.
Thank you very much. To the youths out there, I'd say your body, your choice, and it is yours alone. You don't have to share it with anyone. Seek the right information from the right people and access these offices that provide health care services. And also demand for comprehensive education and services that cater to your needs, as well as breaking the silence of stigma surrounding sexual related issues of human rights. And then together we can create a world where everyone can enjoy their sexual rights free from coercion, discrimination and violence. We just have to know our rights. If you know your rights, knowledge is power. No one can take it away from you. You are a human being. You're supposed to enjoy your rights as provided under the Constitution. Thank you very much.
Thank you so much. Yes, your concluding message, Kondwelan.
Thank you. So my message to the youth there is, let's not shun away from health facilities. Let's access services. Condoms are free, so don't shun away and get to have STIs or HIV. Use protection always and ensure that you inform your friends about services that are offered at the clinic. The saying that says nothing for us without us. So let's get involved. Let's not leave anyone behind. Thank you.
All right, Amanda.
So for me, my message would be the best way to prevent all these problems, first of all, is abstinence. So we abstain from doing some of these sexual practices when you get to know about them. Get to know about them in right places and seek medical advice when you feel that something is not right with you. Because your health is your well-being, and a healthy nation prospers.
Great. Mr. Mumbai.
Yes, my last message to the young people is that even the Bible says, enjoy your youth. So have fun, enjoy, but do it safely. And I want to encourage young people to be very participative in these issues, not just to be spectators. You know, last week we had the regional Indaba with young people, we call it Dera High, talking about health issues. A lot of interesting issues came out there, and young people are willing and are interested to participate. But the energy that was coming from other countries was so much more than our energy. Young people, we are talking about your life. You live once. Take care of your life. Ensure that you also do not offend the laws of this country in as much as you are enjoying. Can we also be receptive of old people? Because these people, even if they look, anxious, these are the people that have the experience and the information. Can we appreciate what they have to tell us and keep moving, because this is our country.
All right. And on that note, it only remains for me to thank you for finding time to come through to the program. Otherwise, it's been insightful. Thank you for your contributions. Okay?
Thank you, sir.
Oh, great. Well, those were the expressions of young people on today's edition of Youth at Crossroads. We're focusing on the state of sexual and reproductive health rights in Zambia. I've been your presenter, Boniface Chansam Kopa. Until next time, it's goodbye.
This is Youth at Crossroads,
Youth at Crossroads.
a program that brings out expressions of young people.
Young people.
I would like to pick your minds on this question. Who is your ideal date?
Youth at Crossroads.
A person can think about dating when they are mature enough to handle the
Youth at Crossroads.
I'm of the person that age is nothing but a number. When you're good enough, you're good enough.
Youth at Crossroads.
This is Youth